everyone. Thank you for tuning in to this free online podcast presented by Miller and Associates Equine Veterinarian. This podcast will focus on preventing and managing summer allergies in your horse and will be presented by our Associate Veterinarian, Dr. Elizabeth Kilgallen. Dr. Kilgallen, thank you for joining us today. Would you like to briefly introduce yourself before we begin?
Sure. Thank you very much. Thank you for having me, and I hope everybody out there is well and staying safe. I have been associated with Miller & Associates practice for quite a while now, probably around 15 years. I attended Tufts University School of Veterinary Medicine and went on to do an internship and residency in large animal surgery at the University of Pennsylvania. And I'm board certified in large animal surgery and now conducting a pretty basic all-around equine surgical and medical practice out of the Miller & Associates facility here in New York.
Awesome. Well, we're so glad to have you. The first question today comes from our audience, and they're asking, how would you treat a horse that has recurrent hives but is sensitive to steroids because of an underlying condition such as PPID, formerly known as Cushing's disease, or laminitis, for example? This person would also like to know what happens if you don't treat those hives.
Okay. Well, first of all, it's just that everybody's on the same page. The concern with horses that have what used to be called Cushing's syndrome or disease and is now pituitary disease, PPID, is that those horses are more prone to developing laminitis associated with steroid administration. And that can be both intravenous, intramuscular, and oral steroids. In rare cases, inhaled steroids can also cause some negative side effects in the body. So it is concerning when you have a horse that is being treated for those diseases or is suspected to have PPID or metabolic disease, and giving them steroids may cause an owner reasonable amount of concern. First thing is hives are typically self-limiting, meaning that they're ugly. They're almost always the cause of an emergency call. Rarely are they anything terribly serious. There are serious complications like angioedema and purpura, which are very different looking than your average sprinkling of hives over the neck, body, flanks, and occasionally muzzle. I have, in 35 years, have not had a horse that developed severe enough inflammation or swelling around the muzzle or the throat latch to make me concerned that they were going to have any kind of obstruction, but they can be very uncomfortable. Certainly the owners find them very unattractive and often want them to go away. It's also a big concern in horses that are show horses and need to look good. So the first thing that we have to think about when we have a horse, particularly one that has a pre-existing condition, is trying to identify why this horse has hives. That's often a big detective job, and it is hard sometimes to know when the inciting allergen is in the area, because they can develop hives as early as 10 or 15 minutes after exposure, and sometimes it takes up to 24 hours of exposure after exposure before they're going to develop the signs. So looking at the environment, looking at what may have changed in the environment. It may be as simple as a new shipload of hay. It could be a change in the grain that they're eating. It could be a change in the weather. There can be pollen. Anything like that can be a potential allergen. So what you want to try to do is be a detective and try to eliminate as many of those potential allergens as you can when you're trying to treat a horse that you don't want to use steroids on, or this applies to any other horse as well. What I recommend is stopping all non-essential medications and supplements, sometimes taking them down to just soaked hay, and then gradually adding back all of these things to determine if one of these might be giving them the hives. The other thing to look at in management is, where's your hay? If it's stored above the stall, that's not good. There's dust coming down that can carry allergens to the horse. Also, what's the airflow in your barn like? Horses are animals and have hair, so they don't need to be tucked up tight. In the summertime, particularly, using fans to disperse the insects is really important. The disturbance of the air by the fan confuses the insects and often makes them so dizzy they don't actually land. For horses that are very sensitive to insects, that's very important. Not letting them graze early in the dawn and dusk time when the insects are most active is important. As I said before, soaking the hay can decrease the number of allergens in there. You do need to make sure that you don't soak it for too long. I say at least 20 minutes and no more than 2 hours. And you want to drain it after you soak it. Looking at the shavings or what kind of bedding the horse is on. I actually did have one horse that we couldn't figure out what was going on until we realized that he was allergic to something in the plastic in the bags that were covering the shavings. So we had to source paper bag covered shavings for him from Canada. And the minute we gave him shavings from a plastic bag, it would start again. Looking at laundry detergent, sometimes it can be shampoo or laundry detergent or bug spray. So those are all the things that you can do about the environment. In terms of medicating these horses that are sensitive to steroids and or any other horse, because you don't want a horse on chronic steroids if you can avoid it. Hydroxizine and Cetirizine, Cetirizine is Zyrtec, which is available for humans. Those are both antihistamines. They are safe for these horses that are Cushingoid or metabolic. And you can give those. They sometimes cause them to be a little bit drowsy. The hydroxyzine, in my opinion, more than the cetirizine, but both of those will not actually stop hives that are already there. Hives that are already there just need time to go away. But what the hydroxyzine and the cetirizine can do is help to decrease the recurrence of these hives. Also, there's some support for increasing the omega-3 fatty acid in the diet. That's most easily accomplished using flax. The important thing to know about flax is that it's pretty calorie dense. So if you've got a fat Cushingoid pony, you need to be a little careful with flax or flax oil. The seeds need to be ground or they're not useful. The seeds degrade almost immediately after being ground if you're grinding your own. So I recommend using one of the stabilized flax formulas that are available from a reputable distributor. It's much better to use than corn oil. The omega-3 is the anti-inflammatory fatty acid. Omega-6 is the pro-inflammatory fatty acid. So we want a higher balance of omega-3s, which is present in that flax. If you do notice that your horse is getting worse, if the swelling is becoming extremely large, uncomfortable, or if there's oozing, then those could be signs of angioedema or a more severe sort of allergic response like anaphylaxis, and that would be a true emergency. But what we're speaking about today is the, sort of typical, like the picture on the title of the podcast, the little pinpoint hives that kind of coalesce together and then eventually go away.
Okay, well, perfect. That was a very informative answer. Thank you. You also covered our second question, which was talking about the common types of allergens and how to reduce our horse's exposure to it. So thank you for covering that very thoroughly. And then our final question for you is, when is allergy testing warranted?
It's important for people to know that there are a couple of different types of allergy testing. There's serum testing, which is, in my opinion, only useful in very certain circumstances. And there's intradermal testing. If you've ever been allergy tested yourself, that's the one where they put the pinpricks of the allergen underneath your skin of your forearm and you wait to see which ones swell up. Now, in a horse, it's a little bit more challenging because we don't have a non-haired area to use. So it requires us to do the intradermal testing, which is the gold standard of allergy testing in horses. We need to get that horse off of all steroids and antihistamines for at least 2 weeks. That means he might go through a period of having hives for quite a while. We shave the hair on the side of the neck and make marks with a magic marker, and then use a kit that is developed that holds the allergens for the area where this horse lives. So, obviously you wouldn't test a horse in the Northeast for allergens in the Southwest because it's not going to be valid. So we get one from the area. We tend to use University of Pennsylvania makes up the kits for us. And then you insert a little bit of that allergen underneath the skin at each site, actually intradermally into the skin, and then go back and read the response that the horse has. That information goes back to the formulators, and if people want to continue on with desensitization, which is the allergy shots that humans get against allergies, then they make up a kit that is administered at home. It's a long-term project. Many horses don't respond at all. Some don't respond for up to 2 years. So, the allergy testing is sometimes used more to try to eliminate things from the environment than to actually specifically treat them or desensitize them to those allergens. There are some things you can't avoid, obviously, but you can minimize others. The serum testing, which is obviously easier and less invasive to the horse, often gives false positives. The one time I use the serum testing is to try to help identify food allergies. Even if there is a false positive, at least I have an idea of what may be bothering that horse, and often I can help people to modify the diet so that those things that the horse seems to be responding to are eliminated or at least minimized.
Okay, that was very informative as well. Dr. Kilgallen, thank you so much for your time. I'm sure our audience out there have learned a lot from your podcast today. So again, thanks so much for your time. We're so glad to have you today.
Thank you very much for having me.